I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the PEP Talk on May 15, 2021. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. My PEP Talk today is entitled Maximizing Defrayment of Operation Expenses Using PhilHealth and Other Government Privileges. The empowerment objective is for the lay people to have a basic understanding on how to maximize defrayment of operation expenses using PhilHealth and other government privileges in their health management. The contents will be the following: why the need to maximize defrayment of medical and operation expenses, with focus on operation expenses, who are the main actors in maximizing defrayment of operation expenses, how to maximize defrayment of operation expenses using PhilHealth and other government privileges, and then ROJoson's other advice on how to maximize defrayment of operation expenses using PhilHealth and other government privileges. Why the need to maximize defrayment of medical operation expenses? Because of the trend, rising health care costs in the Philippines, not only in the Philippines, but all over the world. Medical inflation refers to the medical trends and development and the increase in cost to support them. We all know that there are a lot of new and rapid developments in medicine, and these are very costly and costlier than before. Thus, medical inflation is expected to increase. Healthcare costs are increasing due to the following factors: high cost of pharmaceuticals, especially the newer ones, new diagnostics and procedures, overprescribing of low value, not essential health tests and procedures. In a study, Vincent Gregory Yu said the health financing experiences of ordinary Filipinos can be summed up in 4 P's: pagtitiis, pangungutang, pagmamakaawa, and PhilHealth. Pagtitiis, which means enduring symptoms of health conditions, involves refusing to seek treatment and resorting to self-medication. Filipinos would also turn to alternative or traditional medicine. Pangungutang. For Filipinos, pangungutang or borrowing money often becomes their first resort in addressing their medical needs. Unfortunately, this often leads to more catastrophes. The third P is pagmamakaawa, which refers to the process of soliciting help from state and private institutions and individuals. This often happens as a last resort when no friend or family can lend them money, or one has exhausted donations from them. The last P, PhilHealth, this referred to the state health insurer in health financing. This is access only when Filipinos are usually already hospitalized, but nowadays outpatient benefits are also included. Let me make an operational definition of terms at this point. Operation expense, expenses associated with surgical care or operation. Medical expenses, expenses associated with non-surgical care or operations. And then defrayment, payment of some or all charges or expenses from non-personal sources and not out-of-pocket transaction. Our focus today will be on operation expenses. An operation or surgery is very costly. The trend is an increasing cost for operation, and a lot of Filipino patients are burdened with the high cost of operation or surgery. In this pep talk, I will try to advise how to maximize defrayment of operation expenses, how to minimize personal expenses using PhilHealth and other government privileges. This is part of my patient-centered care management program, as well as part of my compassionate humanitarian program. Who are the main actors in maximizing defrayment of operation expenses? The main actors who can help in maximizing defrayment of operation expenses rest on two: the surgeon and the patient. When I say patient, this is inclusive of relatives and guardians. First, the surgeon. The surgeon who is compassionate in helping patients maximize defrayment of operation expenses through the following means or strategies: being effective and efficient, or being cost-effective in operative management; doing high value, meaning essential only operations and diagnostic procedures; prescribing high value, meaning essential only medications and non-operative support procedures; charging a compassionate, reasonable professional fee; and lastly, advising patients on how to maximize defrayment of operations expenses using PhilHealth and other government privileges. This will be discussed later on. Another factor will be the patient. And when I say patient, it's inclusive of relatives and guardians. Patient who can be empowered, if not already empowered, through the following: exercising the right to ask surgeons how much will the operation cost and their advice on how to control and defray the expenses; having knowledge of PhilHealth and other government privileges that can be used for defraying operative expenses; and lastly, having perseverance in seeking out other external resources for defrayment of expenses if indicated. How to maximize defrayment of operation expenses using PhilHealth and other government privileges. Here is a partial list of resource options: PhilHealth benefit, senior citizen privilege and benefit, PWD or patient with disability privilege and benefit, Malasakit Center, which includes also the following: DSWD, PCSO, and PubCore, LGU or local government units, which include the mayors, councilors, and governors, Office of the Vice President, congressmen and senators, GSIS benefits or even SSS benefits, and others. PhilHealth benefit. Who can avail of the PhilHealth benefits? Non-senior citizen and non-PWD, public and private employees, senior citizens, PWDs, dependent of PhilHealth members, indigent patients. You need a certificate of indigency, or if you are a sponsored member. Voluntary basis for the non-senior citizen, non-PWD, and self-employed. And then lifetime members, these are the non-senior citizen, PWD, and who are retirees with 120 contributions of payment to PhilHealth. The non-senior citizens and PWD, meaning the public and private employees, they usually pay the PhilHealth through a company payroll deduction. So in 2023, the deduction is 4.5%. In 2024 to 2025, it will be 5%. For those who are voluntary or self-employed, they will have to remit a full 4% of their declared monthly income. Now, who can avail of the PhilHealth for free? The senior citizen, PWD, dependent of PhilHealth members, indigent patients, as long as their certificate of indigency, or the patients, the members are sponsored members by some organizations, and then lifetime members. Although the PhilHealth does not usually cover the entire amount of the operative cost, it has a large subsidy to defray surgical expenses. The coverage will be both inpatients and outpatients operations. And then usually the PhilHealth pay the operations through the so-called procedure case rates. Example, for incision and drainage pyramidal cyst, the benefit that the patient will get will be 2,800. So if the hospital bill is 2,800, then this 2,800 will be paid by PhilHealth. There will be no out-of-pocket cash out by the patient. But if the hospital bill is more than 2,008, then with PhilHealth benefit of 2,008, the balance will have to be shouldered by the patient through some means, whether it's out of pocket or through other means. Another example, mastectomy, modified radical mastectomy here. In this category, 19,240. The benefit here for the PhilHealth patient member will be 13,200. Then for thyroidectomy, example, total or complete, the benefit that the patient will get will be 18,600. So using an example, if the total hospital bill, which does not include the PF yet, is 26,000, PF means professional fee, is 26,000 for the mastectomy operation without senior citizen and PWD yet. The PhilHealth coverage, if the PhilHealth coverage is for this mastectomy operation is 13,200. So there is a balance of 12,800 pesos which has to be paid. In private hospital, for example, which is usually more expensive, the total hospital bill is 50,000, example. So the balance after removing the PhilHealth benefit of 13,200 will be 36,800 pesos. So bigger than the one in a cheaper hospital or a government hospital. Now, for thyroidectomy, if the total hospital bill is 26,000, not including the PF, and without senior citizen and PWD, and if the PhilHealth coverage is 18,600, there will be a balance of 8,400, which has to be paid. If the total hospital bill is 26,000, which does not include the PF for mastectomy operations, and without PF yet, and then if you apply the senior citizen or PWD benefit, there's a 20% discount. So the balance will be 20,800. You subtract 5,200 from 26,000 pesos. And if the PhilHealth coverage is 13,200, the overall balance will be 7,600 pesos, which has to be paid. PhilHealth also offered the so-called C packages for 20 severe medically and economically catastrophic illnesses. This includes the early stage of breast cancer, prostatic cancer, colon cancers, heart and kidney, especially kidney transplantation, and others. The so-called no balance billing, which is a policy of the government implemented through the PhilHealth, which ensures that qualified members shall not be charged or be forced to spend out of pocket for services that have been rendered to them in government hospitals and selected private hospitals that are PhilHealth accredited. To be applicable for the NBB, there must be a declaration of NBB policy by the hospital, and only qualified patients can avail of this benefit. So usually the determining factor is that the patient must be in the ward accommodation and not in a private room. So here is the policy of the no balance billing in hospitals. All government general hospitals shall allot 90% of their approved bed capacity to ward accommodation for NBB. For specialty hospitals, government, 70%, and then for private hospital, only 10% is required. Senior citizen privilege and benefit, you have 20% discount. For PWD privilege and benefit, you have 20% discount. And type of PWD which are qualified for this one will be those who are physically disabled, mentally disabled, and currently more recently, cancer diagnosis was also a qualification for PWD. So all cancer patients under 60 years old are entitled to have a PWD certificate, privilege, and benefit. This is based on the Republic Act number 11215, and all cancer PWD patients are entitled to have a mandatory PhilHealth coverage under Republic Act 11228. This is an example picture of a PWD certificate used based on the disability of cancer. So malasakit centers are other options, and then the others will be the LGU, Office of the Vice President, Congressmen and Senators, GSIS, and SSS benefits. The malasakit center refers to a chain of one-stop shop centers for medical and financial assistance provided by various agencies of the Philippine government, such as PCSO, PhilHealth, PAGCOR, and DSWD. So how to process the paper will be for inpatients, go to the billing section of the hospital and ask for an assessment of your billing and for a medical abstract. Bring this to the malasakit center. In the center, you'll be asked to fill up the form to request for medical assistance. The social worker in the center will assist and direct you to the PhilHealth desk for coverage first. If you are not a PhilHealth member, you'll be automatically given a membership. If the amount covered by the PhilHealth is insufficient, you will then be directed to PCSO and DOH and other agencies within the Malasakit Center who will get the additional funds from the Presidential Social Fund. If the assistance will not be in cash, but in the form of a document that gives you the funding for your hospital bills, just present it to the hospital billing section and it will be deducted from your bill. The patient may avail up to 50,000 from the Presidential Social Fund or PSF, depending on the assessment coming from the different government agencies. So the other agencies that can be that can be approached for the defrayment of expenses will be the PCSO. Okay, there is a so-called PCSO Individual Medical Assistance Program, and then also the DSWD and PAGCOR, they have their own program that can be tapped. The LGU, local government, mayors, and governors and councilors, Office of the Vice President, Congressmen, and Senators, usually the financial assistance comes in the form of guaranteed letters, okay, with the amount to defray the expenses. This is an example of a request of a patient requesting for financial assistance from the Office of the Punong Barangay. Okay, so there's a requirement to present the prescription, okay, na may address ng doktor, pangalan ng doktor, and then quotation of the operations, kung magkano, then voter's certification. As to my advice on how to maximize defrayment of operation expenses using PhilHealth and other government privileges, first, I'd like to say, ask your surgeons to help you. Look for surgeons who can help you. Ask your surgeons, if possible, to minimize the expenses without suffering good outcomes, the so-called value-based management. So try to decide whether there's a need to have the operations on an inpatient or outpatient, whether a government or private hospitals will be a better choice, cost-effective operative management from the surgeon, and high-value medical treatment also from the surgeon. As a personal practice, I usually discourage patients from getting loans with high interest rate just to defray the operation expenses. I usually go all out to help them. Then another advice is prepare all the necessary documents from the government agencies for defrayment of expenses before admission to the hospital. Because if the documents are not complete, discharge will be delayed and there will be added expenses on the use of hospital beds and rooms, and then this may defeat the purpose of defrayment. So with all the above advice, on how to maximize defrayment of operation expenses using a lot of resources. There should be no reason now for pagtitiis, for the surgical disease to become far advanced and because of financial difficulty. So on top of what I have mentioned, there are charity government hospitals to offer health and also private hospitals with a social responsibility program, and then surgeons and anesthesiologists who can give free services for patients in need. So summary takeaway, I have covered all these topics. I will not mention them anymore. And then for takeaway in relation to patient empowerment, be always in touch with reliable medical information on the defrayment of operation expenses. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment, kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions in the defrayment of operation expenses in One Health management. So with this, I end my pep talk. I hope I have empowered you to have a better understanding on how to maximize the defrayment of operation expenses using PhilHealth and other government privileges in your health management. Thank you and good day. Okay. Okay, open forum on this pep talk on maximizing defrayment of operation expenses using PhilHealth and other government privileges. Okay? So, Kat, so go ahead.
Yun nga po yung experience ko na naturuan niyo ako na yun nga, yung sa PhilHealth. Yun lang talaga yung sa PhilHealth doc, late ko na nga nalaman pero naayos naman. Then sa government naman, awa naman dito sa Manila, yung government namin dito sa Manila, nagbigay din naman ng konting tulong. Then, parang ano pa do, thankful kasi sobra-sobra pa yung naipon ko. So, may pambiling gamot.
Aha, okay.
Yun po.
So, anong problema mo sa PhilHealth?
Yung one of the problem, nung pumunta po ako, ang sabi ko, cancer patient ako. Then gagamitin ko yung PhilHealth ko kasi nag-advance payment naman ako. Tapos nung sinabi nilang kailangan ko magbayad. Kasi gagamitin ko. Sabi ko, cancer patient po ako, bakit ako magbabayad? So wala, sa kagustuhan ko na lang, syempre walang maging problema sa PhilHealth. Binayaran ko yung PhilHealth ko.
Ano?
Sabi niyo nga po sa akin.
Yeah. Now, can you expound on that? I want to
Sabi niyo nga po sa akin, dapat hindi ko binayaran yung PhilHealth.
Tinanggap nila?
Hindi po, Dok, ngayon pa lang, ayusin pa lang daw. Pagkatapos, etong naoperahan na ako, tsaka lang daw nila ayusin, mag-i-issue sila ng certificate. Sabi ko, nakapagbayad na ako, good for 1 year. Ngayon ka lang kayo mag-i-issue ng certificate na ina-acknowledge na PWD ako.
Okay. Now, I want to explore that because yan ang napapansin ko, nahuhuli ang PhilHealth, no? Doon sa implementation ng law, no? So if you are paying before, tapos hindi mo na tinutuloy, hahabulin ka pa niyan, di ba? Kahit na may PWD ka na, di ba? So
Hindi daw kasi updated ako sa pagbayad.
Updated ka?
Updated po ako sa pagbayad. Opo, binayaran ko na 1 buong taon ng January pa lang.
Okay. So hindi mo alam na hindi mo alam na entitled ka.
Hindi po.
Okay. So nagbayad ka. Nagbayad ka na. So may PhilHealth ka na, wala nang problema. Tama?
Opo,
okay. So now I'm trying to can I ask everybody to listen kasi ito yung pinaka-challenge ko ngayon. I don't know how to solve it, na. Yung mga nagpi-PhilHealth, nagbayad ng konti, tapos medyo nabitaw, hindi natutuloy pagbayad, no? Minsan, di ba? Hindi tinutuloy ng mga members na ipagbayad, no? So, when I asked them, kasi entitled sila sa PhilHealth because of their PWD, no? Yung senior citizen walang problema, no? Ito yung PWD ang ang may mga hitches diyan, no? So kung may PWD ka, dapat automatically PhilHealth ka na di ba? Okay? But ang ginagawa yata ng PhilHealth, papabayad ka pa, no? Parang di nila nare-recognize yung law pa rin. Hindi pa nila ginagamit. No? Okay. So they will ask you to pay yung balance for the remaining years, no? Para ma-avail mo. Okay? So yan ang napapansin ko. I don't know how we can how I can help you. Okay? So I hope some of you present here who have experienced that, can you share with me later on anong ginawa ninyo, no? Okay, meron ba? Baka wala, no? So anyway, yung PhilHealth yung isang kasi malaking makukuha mo sa PhilHealth no? So yung sa'yo, 18,000 makukuha mo, di ba?
Yes po, Doc.
So ano yung sinasabi mo, hindi pa nasusubtract?
Nabawas na po, Doc. Ngayon ang inano ko po, nung paglabas ko, may nagsabi sa akin na dapat hindi ko binayaran yung 10 taon.
Okay. Tama ngayon. Dapat may buong nabayaran. Okay. Okay. So learn from it, di ba? Mahirap na i-refund yun. Pwede pa bang i-refund yun? Baka hindi.
Doc eh.
Sige, learn from it, ha? Okay, sinabi rin sa iyo ng PGH na dapat hindi mo nabayaran 'yon.
Yes po, dapat daw po ano nga konti lang, kumbaga parang updated naman pala yung bayad ko. Kahit hindi ko naman pala siya bayaran, magagamit ko daw.
Okay, kasi PWD ka, ganon.
Opo, dapat humingi daw pala ako ng certificate.
Yeah, okay. So okay, those with PWD, ayusin na niyo yung PhilHealth niyo, no? Para hindi magulo, no? Yung senior citizen medyo mas madali no? Walang question na yan, no? Okay. Okay. So naghumingi ka ng assistance from the Manila government? Sabi mo?
Po, opo, Manila government.
Saan? Saan? Can you share? Saan?
Sa City Hall po.
City Hall. So paano,
Opo,
saan ka pumunta doon?
sa baba po, do sa DSWD po. MSD, sa DSWD nila po, sa baba. Kung saan din kumukuha ng PWD ID.
PWD ID, and then yung financial assistance.
Financial assistant, humingi po ako sa DSWD sa may Gastambide.
Okay.
Madaling araw, nakapila ka na. Then, Office of the Mayor, congressman namin, saka yung mga ilang konsihal.
Okay. So pinuntahan mo isa-isa? Tatlo?
Yes naman po, pero mga hindi naman po ako naghintay ng matagal nung sinabi kong ooperahan na ako within this day. So wala pang 1 week, nag-release sila kagad ng budget para sa akin.
Okay.
Kaya nagpapasalamat naman ako.
So ilan ang nakuha mo?
3,000, 2,000. Siguro nakaano rin po, 7K.
7K?
7K. 7K po. Mga 7K, mga 8 yata po yun. Hindi ko na nabilang. Pinagsama-sama ko na kasi iba.
Ayan, sama-sama. So, paki-breakdown nga para malaman lang namin. How much did you get from the counselor? If you don't mind, ha? Para may idea lang.
Okay po. Yung counselor namin hindi pantay-pantay. So, yung dalawang counselor, 300. Tapos, yung dalawa, bali 500, 1,000. 4 na counselor lang po yung nagbigay. Tapos, si Vice Mayor is 3,000. Si Mayor is 3,000. DSWD is 3,000. Ay, naka 9,000 pala ako, Dok. 9,400.
Okay, so iba-ibang rates na. Iba-ibang
Tapo.
So, hindi ka nahirapan humingi.
Tiyaga lang po talaga sa pila. Madaling araw pa sa DSWD.
Okay. Okay. So, anong binigay sa iyo? Cash na? O may guarantee letter? Wala.
Cash na po hiningi ko kasi kung guarantee letter, ang tagal nila ibigay. Tapos, wala naman akong liquidation talaga nung magkano gagastusin ko. Kaya nag-cash na lang po.
Okay. So, pwede pala yun. Cash na ibibigay. So,
Opo, mamimili po kayo.
kung cash, konti lang. Kung guaranteed letter, mas malaki.
Opo, pero magtagal i-release yung guarantee letter eh.
Okay. Sige. Thank you. Thank you. At least may ano. Kasi hindi po masyado kabisado yung mga sa local government eh. No? Okay.
Okay po.
Anything else that you want to share, Kat?
Ito ba? Tawag dito. Ano lang po, wag matakot magtanong po sa inyo kasi tuturuan niyo talaga. Talagang yung expected ko sobrang laki yung gagastusin ko.
Yeah. Okay.
Ilang po.
So, importante yung surgeon to help you. Communicate with your surgeon, no? Okay.
Ano lang po, tatlo lang po ang pagkakatiwalaan nyo. Diyos, doktor nyo, sarili nyo.
Okay. Okay. Thank you. Thank you very much. Okay. Anybody else who want to share? Sinong may experience doon? Anybody? Okay.
Dok, may tatanong ako.
Sige, Perla.
Kasi Dok, meron akong card. Ang sabi sa ospital, hindi na raw bawawasan ng senior citizen pag may card. Ganun po ba yun? Kasi pinapabawas ko yung senior citizen na discount ko pag may mga laboratory, halimbawa kung ano ang papagawa ko sa ospital. Yung sabi nila pag card daw, hindi na raw babawasan ng senior citizen.
Ang card, HMO's card. HMO.
Yes, Doctor, HMO.
HMO card.
Diba, may card ka na, yung mga card, Doctor, HMO card. Kasi meron akong PhilHealth card.
Okay. Sandali.
Pag nagpapagawa ako ng laboratory, minsan mga ibang hospital, ayaw na nilang magbawas. Pag senior ako, sabi ko, pwede mo bang idikman? Ay, pag may card po, hindi na. Hindi, binayaran ko naman yung card ko, kako. Sabi ko, Doktor. Pero yung mga ibang hospital, hindi na nila binabawas yung discount na 20%.
Paano ka ba sasagutin yun? Anybody who wants to share? Anybody? Paano tutulungan natin si Perla?
Minsan hindi nila binabawas. Yung iba naman binabawas. Kasi sabi ko, binayaran ko naman yung card ko na yan. Sabi ko, hindi naman porke may card ako, libre na yan. Ay dapat mabawasan din ako ng 20% discount.
So you're using the same card pero yung ibang services hindi binabawasan, yung ibang services binabawasan.
Binabawasan.
Baka nakalimutan lang ng ano.
Hindi, sinasabi ko minsan, Doktor, meron naman yung kagaya doon sa heart station sa Manila Docs. Minsan tinatanong nila yung card ko. Binabawasan nila automatic yun. Yung mga ibang department naman, hindi sila nagbabawas.
Sige. So as a patient, probably you have to insist na bawasan nila. Pwede pa lang bawasan eh.
Yung mga iba kasi hindi dahil pumunta ka pa sa cashier. Mga iba, utusan ka pumunta sa cashier, magpabawas doon. Pero yung mga iba, automatic naman na pag kinumpute na kung magkano yung na procedure, automatic na binabawas. Pero yung mga iba, hindi.
Okay. Abet, anong input mo dyan?
I'm not really particular about that, but I think they have to deduct the 20% discount even if they're using their HMO card. That's the standard eh. I don't know kung bakit yung iba hindi nila dinideduct yun.
Kasi card ng araw, yun ang rason nila is, meron na po kayong card. Kahit na may card ako kako, binayaran ko naman yan, card ko. So I am entitled for a 20% discount.
That is mandatory eh. I don't know bakit yung iba hindi sila nag-aano ng discount. But it is a mandatory whether you use your card or you pay in cash.
Oh, dapat nga po, ganun, di ba? Pero, minsan, di ko na nga lang pinipilit kasi para mabilis.
Pilitin mo kasi that's your right. I think
It's
kasi,
mandatory.
oo, mukhang as you said, yung ibang centers hindi ginagawa, yung ibang centers na ginagawa. So hindi talagang hindi talagang fix yung rule na yon, no? Okay? So baka nagkamali lang yung isa, yung interpretation, no? So you have to insist, no?
No.
Okay. Insist mo na lang kasi hindi parang dun sa mga restaurant, di ba? Kung meron silang mga sale o kaya may mga promo, sasabihin nila agad, hindi nakasama, di ba? Kasi may promo sila, di ba? Pero kung wala silang binabanggit noon, dapat i-discount nila yung senior citizen, di ba?
Oo nga po eh.
So yung sa
Maalala ko, Doctor, speaking of restaurant, kasi minsan kumain ako sa McDo, nag-order ako ng chicken, ice cream, mayroon pang mga french fries. Nung siningil, ang binawas sa akin, sabi ko, bakit magkano bawas mo? Ang bawawasan lang daw niya is yung chicken. Sabi ko, ikakainin ko naman yan, yung ice cream at saka french fries, bakit hindi mo bawasan? Sabi ko, ang babawasan lang daw niya yung chicken kasi yun daw ang kakainin ko. Wala, ano ba yan? Sabi ko, hindi ko maintindihan yung senior citizen na discount sa mga restaurant, Doktor. Minsan,
medyo magulo. Tanungin mo na lang.
Magulo nga eh. Minsan, binabawas lang, dinidiscount lang, mga 150, kahit na magkano ang bibilhin mo. Minsan, mga 180 lang. Ganun pa talaga.
Okay. Tanungin mo na lang. Kung like to go around it na lang. Kasi parang kung isa may nag-order ako na dalawang chicken, ang bibigyan lang sa akin yung senior citizen discount, isa lang, no? Isang chicken lang. Sabi ko,
wala na yung mga iba.
Kakainin ko mamayang gabi yung isa kaysa babalik pa ako.
Oo nga, okay. Isa lang i-discount nila kasi yun na lang kakainin. Ano ba?
Parang sa gamot din yan. They don't give you everything. 1 month lang, di ba? 1 month supply lang, di ba? Ganun din. So they're trying to control yung mga senior citizen privileges also.
So the lesson of that, yung sa chicken mo, Doctor, you're supposed to order 2-piece chicken instead of 1-piece chicken.
Kailangan mabawasan nila.
Kasi Doc, kasi dati ako sa service crew. Kung anong combo meal na in-order mo, isang combo meal, yun lang po may discount. Pag umorder ka pa panibago, wala nang discount.
Yeah, ganun din. Maraming idiosyncrasies, maraming No?
Kung nakahiwala yung ice cream at french fries mo do sa combo meal, hindi kasama sa discount.
Hindi na nga kasama kasi daw ang kasama lang yung meal mo, yung pagkain mo na chicken.
Yun po talaga ang rules kahit nung nagtrabaho ako sa Jollibee.
Okay. Anyway, going back to sa mga medicine, ganun sa HMOs, ganun. Sa HMOs, you have a privilege of, let's say, yung benefit of 200,000 or 120,000, di ba? May kumisan gano'n ng premium mo. Tapos, kung na-hospitalize ka, no, they will subtract your PhilHealth mo na. They also require you to have PhilHealth. Tama? PhilHealth.
Yes
Okay.
po.
Kung merong senior citizen, pabor sa kanila yun, di ba? Okay. So, isusubtract muna nila yung PhilHealth benefit para buwaba yung babayaran ng HMOs sa hospital. Na? Kung may senior citizen kayo, may 20%, mababawasan ulit. Kaya konti lang babayaran ng HMOs. Yan ang gusto nilang mangyari. Na? Okay?
Opo, PhilHealth. Kailangan i-file mo yun bago ka lumabas.
Ipa-file mo.
Kasi if not, babayaran mo yun eh.
Kung wala,
mo
papabayad sa iyo. Di ba? Kung wala, papabayad
papabayad sa iyo yun.
Okay. So you can see the usefulness of the PhilHealth. So to the point that if HMOs take advantage of it. Okay. So any more questions? Anybody who wants to share experience? Lorly, may experience ka ba, Lorly? Rica Forte? Si Lorly yata hindi rin ng guaranteed letter. Lorly,
Ito hindi, humingi po ako noon, pero parang hindi naman po ako binigyan nun.
Bakit?
Kasi ano po yun eh. Ang sabi sa PG po kasi nung operahan na ako noon, pero yung hingi po ako ng parang financial assistance dahil sa chemo ko. Hindi po hindi po nila dahil sa ang sabi, nakalimutan ko na eh. Ang sabi po kasi hindi daw pwede PGH na daw po ako. Iba yung mga nabigyan noon, yung mga iba-ibang yung mga iba-ibang pasyente na hindi sa PGH.
So,
Yun yung na-experience ko. Wala akong nakuha nun.
Okay. So dapat before the operation dapat makuha mo.
Yun po yan.
Okay. So tandaan na lang natin yung mga yung mga idiosyncrasies ng mga ganon. So baka
Wala akong alam.
before the operations dapat nakahanda na, di ba? Okay. Kasi after the operations, baka sabihin nila ay hindi ka na qualified ganun. Okay. So and then pagtsatsagaan na lang ninyo kung kukuha kayo sa
Ang haba pa ng pila.
Mahaba ang pila talaga, no? Okay.
Madaling araw pa lang, pila ka na.
Yeah, so I said, perseverance, magtsatsaga kayo, pipila kayo.
Opo.
Tatanong lang ninyo kung sulit, kung sa 300 lang, wag na lang sa pila.
Opo.
By the 1,000, pwede pa, di ba? Okay. So any more comments? Linda? Ano ba experience si Linda at si Melanie? Linda na isa, meron ka bang i-share?
Hi po, Doc. Good afternoon po.
Meron ka bang i-share on the topic?
Actually po, as a government employee po kasi, DepEd po ako. After po ng aking operation, nagtatanong po ako dun sa aming ADAS officer, dun po sa aming school, kung paano po makakahingi ng medical assistance from the governor's office.
Okay.
Ngayon po Doc, ibinigay ko po yung mga requirements, yung pong medical certificate, tapos po ay yung pong mga result ng iyong mga laboratory test. At the end po, nung maipasa na po namin siya lahat, hiningi po yung ano po yung mga gamot na ipinibigay ng doktor. Kumbaga po tinitignan. So, ang ginawa po namin, resibo, pati po yung mga pati po yung pong inibigay na po doc, yung pong ibinigay na kung ano yung mga gamot.
And at the end, ang sabi po ng ADAS namin, ano daw po pala, ang kailangan daw po pala ay hindi mo pa nabibili yung gamot. Which is nung kinompute po, Doc, parang lumalabas lamang na nasa 1,000 plus lang yung pwede kong ma-avail. So ang sabi po nung ADAS namin, ma'am, nagkikemo ka po ba? Ano pa po ba yung mga gamot na nilili mo? Sabi ko ay ano po, on process pa po. Iko-continue pa, check up pa. Parang ganun po yung sabi ko. So, ibig po sabihin, medyo mahigpit po yung hindi agad-agad ka makakakuha ng tulong. Although, kompleto yung mga documents mo, hindi sila agad-agad nakakapag. I don't know, Doc, kasi government employee po kasi ako eh. So yun po yung experience ko. Kaya sabi po ng ADAS namin, ma'am, wag po muna natin kunin. Baka po meron pa po si Doc na ibibigay na nagamot sa'yo na hindi mo pa po nabibili yung reseta po. So yun yung po i-screenshot, ipapakita doon. Parang ganun po. Kailangan na hindi mo pa nabibili yung mga to. Since po, nabili ko na po yung ibang mga gamot. So nung kinompute po yung mga gamot po na hindi pa nabibili, parang almost 1,000 plus din po yung pwede. So, ganun po, Doc, yung experience ko. Thank you po.
Yeah, okay. Medyo mahirap, no? May pagkatsagaan mo, no? Okay. Meron ka bang GSIS benefit?
Doc, sa GSIS po ay pinapatanong pa po dun sa ADAS kasi po, Doc, as of now, hindi pa po kasi ako napasok ng school. Kumbaga po, pag pasok ko pa po sa kapwa asikasuhin. Kasi nagpapatanong po kung pwede pong magkaroon ng disability claim for sa GSIS. Kasi po sa SSS po, nakapag-file na po ako.
Oh, so may makukuha ka sa SSS?
Yes po.
Usually, magkano yon yung mga SSS?
Doc, wala pa po. Hindi pa po siya nare-release. Kumbaga po, nag-file pa lang po ako. So, ang sabi po dun sa SSS is mag-aantay-antay lang po. So, wala pa po akong idea kung magkano po yung pwede po nilang ibigay. Pag GSIS naman po, Doc, di magpa-file pa lang po ako pagpasok ko po sa school.
Okay. So,
Parang matagal, Doktor, pag sa GSIS. Yung sa brother ko, di ba sa Supreme Court siya before. Nung nagkasakit siya, pinag-file ko na siya ng GSIS benefits. Namatay na siya until now, hindi pa namin nakukuha yon para sa family niya. Yung sinasabing guarantee letter, nung inilagay ko kasi siya sa charity patient sa Manila Doctors. So, nung malaki yung bill namin, I think umabot yung bill namin, one confinement is, I think, 250,000. Tapos, nabigyan naman siya ng DSWD ng guarantee letter sa Manila Doctors ng 100,000. That's, I think, the maximum amount na pwede nilang ibigay.
okay.
Sa DSWD. Pero that is with the endorsement of Manila Doctors na naka-confine siya as OPD. Yung may blue card kasi siya sa Manila Doctors eh.
Okay. So, paano didetermine ng DSWD yung amount na ibibigay?
Doon sa diagnosis na ilalagay ng attending physician, kung gaano ka-severe yung kanyang sakit. And then, it has to be, halimbawa, for 3 months, pwede ka uling humingi ng assistance sa DSWD, pero with not the same diagnosis. It should be another. Otherwise, wala na silang ibibigay sa'yo na assistance.
Okay. So, importante pa rin na yun, no? Yung surgeon at yung pasyente.
Yes.
Di ba? Yung surgeon, kami, yung mga doctor pala, not really surgeon, doctor, dapat alam nila yung mga benefits that you can get para tulungan kayo.
Yes,
Kadalasan, ako hindi ko rin alam yung anong basihan ng DSWD, no? So, kung magkano ibibigay sa inyo, kung alam ko, di tutulungan kayo, di ba? To get the maximum, di ba?
Yes. Depende yata sa diagnosis kasi yung iba daw, parang meron naman akong may nagtanong sa akin, parang na-bypass, angioplasty. Parang ang nakuha yata nila is, I think, 30,000 lang yung ibigay.
Okay.
Kasi
Yan ay
yung sa brother ko kasi dialysis yun eh. Kaya siguro maximize,
Okay.
ano.
Kaya nga, so dapat malaman din ng physician kung anong ilalagay
Yes.
doon, no? Kasi kung ilalagay niya yung mga minor diseases, no? Hindi siya nakafocus sa hindi siya seryoso sa paglalagay ng mga diagnosis, baka
Yes,
mali lang
correct.
makukuha niyo, no? Okay. So
Kahit
kung
doctor sa PhilHealth, halimbawa sa PhilHealth, ang pinagagawa ko normally is kakausapin ko yung head ng PhilHealth, tapos paggagawa ko, i-maximize ko yung benefits ng pasyente. Sasabihin ko sa kanya, i-maximize mo na yung yung sa PhilHealth niya. So, mas nagiging malaki yung nakukuhang benefits sa PhilHealth other than doon sa talagang binibase lang nila sa May ganun eh, pwede namang gawin.
kung alam nila yung pasikot-sikot, diba?
Normally, pinamamaximize ko.
Kaya importante rin ng mga pasyente. Dapat alam din ninyo, pero mahirap gawin, no? Kaya,
Yes. That's correct.
So, ang magagawa ko lang, ako on my part, I will try my best to learn more about this, how to help my patients, no? How to maximize, no? And kaya tayo nagle-lecture ngayon, pep talk, no? Para to raise awareness na importante, alam din ninyo, no? Ano yung mga pasikot-sikot diyan, no? Okay. Para ma-maximize, no? Okay. But the bottom line there is mahirap lang. You have to look for kung sa operasyon, you really have to look for a surgeon who will go out of his way to help you. No? Okay. So Perla, you're raising your hands?
Doktor kasi sa GSIS, mayroon employees compensation doon eh. Depende sa sakit. Kagaya maopera ka ng mga mayuma, entitled ka ba ng leave yun eh sa GSIS.
Oo nga. Okay, so meron, di ba? So, i-maximize ninyo yun. So, SSS palagi ko meron din, di ba? Okay. So, I don't know the package nila lang, no? Baka, pero meron, no? I-explore na lang, no?
Oo, meron. Malaki din pag sa depende.
Okay. Okay. So, any more who wants to share their experience? Lana?
To add dun kay Catherine Espero, may sinabi siya na binayaran niya yung PhilHealth ng 1 year.
Yes
Totoo
po,
yun. Oo, alam mo Kat, kasi yung isang boss ko kasi, yung empleyado niya, lagi kong binabayaran 1 year yung kanilang PhilHealth kasi ang purpose niya, baka makalimutan, tapos magkaroon ng problema, di ba? Pero lagi sinasabi ng PhilHealth, hindi dapat. It should be monthly.
Oo.
Bakit? Bakit monthly?
Quarterly.
Ewan ko, Doctor, kasi 1 year, binabayaran ko na yun eh, para wala silang, kasi nga, minsan makakalimutan.
Kaya daw po quarterly.
Tapos parang nag-o-offset na yun eh. Pero, ayun, sabi nila dapat hindi daw. Pero ginagawa ko pa din, yearly kong binabayaran kasi nga pinagbabayaran sa akin yearly kesa monthly. Parang ang katawiran nila is, pag halimbawa, nag-resign yung empleyado, paano mo marirefund yung yung remaining na binayad kung hindi natapos within the year. Ang katawiran naman nung isa is, basta importante na bayaran sila for the whole year.
Sa company po talaga monthly. Pero kasi nag-voluntary na ako. Talagang
I think, Catherine, sa voluntary, as far as I know, pwede kayo magbayad kasi voluntary kayo eh. Pero yun yatang katulad ng mga employed, yun yatang ini-encourage nila na monthly. But voluntary and self-employed, pwede naman sila mag-whole year.
Binayaran ko po nung quarterly ang binayad ko hanggang June. Parang sinabi sa akin na hindi may kasi last year nagtaas ang PhilHealth. So bago siya nagtaas, nagbayad ako ng 1 year. Ngayon hinahabol ako ng PhilHealth. Ang sabi sa akin ng PhilHealth, dapat daw bayaran ko yung tinaas nila. Sabi ko saglit lang po, hindi ko naman alam na nagtaas kayo, tsaka late na. So
No,
nakakaproblema ako.
babayaran
Problema
pa.
ako. Yes, kaya nga po nangyari ko na lang, ginawa na lang 1 year para hindi na po ako magproblema.
Hindi, kasi automatic yun eh. Pag halimbawa, wala pang increase, pero within the year, nagkaroon ng mandatory of increase, ano yun? Babayaran mo yun. Retroactive yun. So, yung kulang mo na dun sa increase, pababayaran talaga yun. Sometimes with penalty pa yun.
Okay.
Kaya nga po, binayaran ko na lang.
Okay. Sige. So, nakita natin medyo maraming mabusisi, no? Mabusisi.
Sobra.
Sobra, no? Okay, but take note that you still need PhilHealth, no? Kasi no? Saka yung PWD, yung senior citizen, clear cut yun eh. Basta kung 60 ka, automatic na yun. Pero yung PWD, kung may cancer kayo, may kaibigan kayo, kamag-anak na may cancer, kung wala pang 60, sabihin nyo, kumuha kagad ng PWD para maraming entitlement, no? Yan ang ginagawa ko, no? Para even before the major operation, may 20% discount na sila kagad, no? Okay. So, any more questions? Wala na? So, if there are no more questions, we'll call it a day. Then, our next topic next week will be kasi magse-celebrate tayo ng National Cancer Survivors Day in June, no? So, first Sunday of June, no? So, masaya ako that in the Philippines, now they are celebrating National Cancer Survivor Day. Ako since 2000-something, 14 yata, dinideclare na yung April 9 as the National Cancer Survivor Day for the Filipinos. Kahit na wala pa. Kasi sabi ko, yan ang bravery ng di ba? So, ngayon, during the past 2 years, lumabas na yung DOH ng National Cancer Survivor Day. No? So kaya nung nakita kayo, masaya na ako. Kaya I will take the opportunity to talk on that National Cancer Survivor Day on the first week of June. No? Okay? So if there are no more questions, thank you for your participation. Thank you for your input. No? So, titingnan ko, I'll take note of your input para matulungan ko ibang pasyente. No? If you have more input, no, sabihin lang niyo sa akin, lalo na yung doon sa mga LGU. Hindi ko kabisado yung mga yung lakaran sa LGU no? Medyo magulo lang yan, no? Okay. Kanya-kanyang yan no? Kanya-kanyang sikap na. Okay? So, okay, thank you very much. We'll see each other next week. Okay.
Thank you.
Bye-bye.
Bye.
Thank you, Do.
Bye-bye.
Thank you.